Hi, my name is Brooke Etheridge, and today I'm going to be talking to you about free diabetic clinics. There is a growing problem of too many diabetics in the emergency room. There is also a growing problem of too many diabetics not knowing how to take care of themselves, and many people being misdiagnosed. Is anyone trying to fix the problem? It does not seem that way. Setting up a free clinic specifically for diabetics could decrease the amount of diabetics in the emergency room due to misdiagnosis and inadequate knowledge of how to take care of oneself by 30%. A free clinic does not come free. Stakeholders would be needed to fund these free clinics. The ideal stakeholder would be a state that wants to take interest and help improve the health of its citizens. Another ideal stakeholder would be a hospital that has a problem with an overabundance of diabetic emergency patients. Also, that they'd be willing to provide staff, leadership, and supplies to help run the clinic. Ideal stakeholders for this project would be people willing to give their time and effort to fix the problem of diabetics in the emergency room. There are things that have to happen in order to achieve this mission. The main goals are to decrease emergency room visits by diabetics, teach diabetics the best way to take care of themselves, and to make sure that everyone that has been diagnosed with diabetes has been properly diagnosed. There are also other important factors that need to happen. Adequate funding needs to be put in place in order for everything to run smoothly, and stakeholders need to be aware of everything that is going on within the clinic and the patients. The staff needs to be highly trained and capable of answering people's questions about diabetes. There needs to be an assurance among the patients that the staff knows what they are talking about and are leading them down the right path for a healthier life. To ensure that patients are sticking with the program put into place, regular follow-ups need to happen for the first 90 days of newly diagnosed patients with a healthcare provider and a nutritionist. Also, yearly follow-ups for type 2 diabetics and quarterly follow-ups for type 1 diabetics. Who is eligible and who is not eligible for the free diabetic clinic? People who are eligible are ones who have recorded instances of regular high and low blood sugar where they had to be brought to the emergency room more than twice. Another eligible factor is having records of those emergency room visits, or they have official referral from their regular physician with adequate evidence of poor diabetic habits. The people not eligible for the free diabetic clinic are ones who do not suffer from regular highs and lows of their blood sugar, have not visited the emergency room for their diabetes, and those who do not have referral from their regular physician. Some potential risks in starting this free clinic are cost effectiveness of the clinic and rising expense of diabetic supplies. If there is not adequate funding for the clinic, then it will fail. Another risk is patient dependency on the clinic. They are not doing what they need to do to better their health at home, and they are depending on the clinic to do all the work for them. Therefore, they are wasting time and resources, also having to handle patients that are in need but do not meet qualifying criteria. Time and resources need to be used on patients that are in desperate need, but referrals and pamphlets can be given to those patients that do not meet the criteria, so they are at least getting some help. To make sure that the clinic is running smoothly and patients are taken care of, there needs to be leaders. Sometimes leaders can have challenges, such as finding and keeping adequate staffing. A way to avoid this problem is to find people that are passionate about what they do. There needs to be a strict interview process to find the right professionals for the job. Another challenge is determining what supplies are deemed necessary and what is not. The solution for this is to convince stakeholders to give a large enough budget with promises of reducing that budget in the future, when the leader figures out what the clinic needs and what it does not. Goal Goal recognition is also a challenge in trying to figure out if the clinic is helping reduce the amount of diabetic emergencies. And the solution for this is to do yearly surveys in emergency rooms to see if there is a decrease in diabetics being in the emergency room. In order for all this to happen, there needs to be stakeholders, because without them there will be no funding. A place to put the clinic needs to be found. Once the clinic is built or set up, proper leadership needs to be appointed so the clinic can run to the best of its ability. Then those leaders need to make sure that they are hiring professionals to ensure that the patients are getting the best care they can. None of this matters if no one knows about it, so there needs to be a proper awareness campaign so people can know that there is a clinic out there that can help them. Once there are patients, there needs to be regular checkups on how the clinic is affecting the patients. All of this would be ideal to happen in a year. Then there needs to be surveys every 3 months in the first year to see if the amount of diabetics in emergency rooms decrease in the area where the clinic is. After that, there needs to be yearly surveys. The decrease of 30% of diabetics that have been in the emergency room do not know how to take care of their diabetes, and those who have been misdiagnosed needs to happen within 2 years. Once that happens, more free diabetic clinics can be built to reduce these problems everywhere. Thank you.